Hello everyone, today we're going to talk about a drug called Bupropion or Wellbutrin. I'm going to give you a brief history of this drug. I'm going to tell you why it's a little different than our other antidepressants we have available to us. I'm going to tell you who should take it, who shouldn't take it, what the side effects are, and other things that you might need to know about this drug called Wellbutrin. What actually really makes it different? To start with, Bupropion was developed in the late 1960s, and it was actually made to be an antipsychotic medication, but it wasn't effective for this. So what happened is, sort of by accident, they learned that it actually worked well for depression. And it became approved by the Food and Drug Administration for the treatment of depression in 1985 under the brand name Wellbutrin. So why is this drug different? Well, most of our antidepressants work by increasing serotonin. We've all heard of the SSRIs. Selective serotonin reuptake inhibitors. Bupropion doesn't work that way. What it does is it increases the levels of norepinephrine and dopamine, which are also neurotransmitters, but they're very different than serotonin. And I can tell you that because it increases dopamine, that's what makes Wellbutrin good at stopping cravings. And that's why we use it for not only cigarette smokers, Zyban, but we also use it in the combination with naltrexone in a drug called Contraindications for weight loss. What do we use Bupropion for? Really, it is mostly used for major depressive disorders, and because it has a different mechanism of action, it is particularly useful for people who, one, have not responded well to SSRIs like Prozac, Paxil, Zoloft, those types of drugs. Or patients who can't tolerate the side effects of SSRIs, specifically the sexual side effects, because serotonin has a big part of that. And because Bupropion doesn't really affect serotonin, that makes it less likely to cause those sexual side effects we see with the SSRIs. So who are good candidates for Wellbutrin? Well, like I just said, those who can't tolerate the SSRI side effects, those who don't get relief of their depression from SSRIs, patients who have bipolar disorder that need an extra antidepressant. A lot of times Bupropion is the best drug for them. People who need more energy. One of the big symptoms of depression is laying around all the time, and Bupropion can actually give people energy. It can also help you lose weight. So if you're worried about gaining weight, Bupropion is a good drug because some of these drugs can really increase your weight gain. Bupropion also works faster, a little bit faster than the SSRIs. So you can expect it, hopefully, to begin to work in just a few weeks, couple weeks maybe, whereas SSRIs usually take longer than that to work. Bupropion has also been used for ADHD. Although this is off-label, we do give it to children sometimes for ADHD. And remember, ADHD doesn't necessarily go away just because you grow up. So it could also be used for that. Now, who are the people that shouldn't take Wellbutrin? Because there are some, and I've got a little story to tell you about this. I often take a look at people's drug regimens and give them ideas of what they should and shouldn't be taking. So they email me their drug list, I look it over, and I give them my recommendations of what to ask the doctor to add, subtract, whatever I see. A girl from Canada, who was one of my TikTok followers, sent me her list, and she was on Wellbutrin. And she also had a pretty severe seizure disorder. Now, this is the first group of people that shouldn't be taking bupropion are people with seizure disorders, because this drug lowers the seizure threshold and is actually contraindicated. So I told her, you really should get this taken off of your list. And she talked to her doctor, and the doctor was unaware that she had a seizure disorder to start with. So make sure to tell your medical team what you actually have going on with your body. If you have a seizure disorder or any type of disease process, make sure they know, because some drugs not only interact with other drugs and foods, but they may also be contraindicated based on something that you have wrong with you, such as a seizure disorder. So because you need to worry about seizures, right, you also can't take bupropion if you have an eating disorder, because eating disorders increase your chances of seizures. If you're an alcoholic who has had seizures from withdrawal in the past, then it's not a good idea to take bupropion. And you really shouldn't drink while you're taking this drug either. So keep that in mind. What are the side effects of bupropion? We know that every single drug has side effects. I've talked about that before. So some of the common ones are insomnia. Because bupropion has stimulating properties, sometimes it can interfere with sleep. And the way to improve this somewhat is make sure you take bupropion in the morning. It can also cause dry mouth. It can cause anxiety in some patients, restlessness, especially when you're first starting to take the medications. It can cause headaches in some people. It may cause gastrointestinal discomfort in some people. And like I talked about earlier, it can actually lead to weight loss, although for most people, this isn't really a bad side effect. It can cause seizures even in people without a seizure disorder in some cases. The risk is pretty small, but it goes up in the situations that we talked about earlier. It can cause problems with your blood pressure. Bupropion may cause changes in blood pressure, especially at higher doses. So it is recommended that you monitor your blood pressure when taking this drug. What are the safety considerations? Well, bupropion is a fairly safe drug, and we've already talked about really the problems with it. And the big one is seizures. It can also cause, like I said, some psychiatric problems, increased anxiety, agitation, or other psychiatric symptoms. If you have bipolar disorder, it's probably the safest antidepressant that you can take. There are drug interactions. It can interact with other medications, so be sure that you provide a comprehensive list of your medications to your pharmacist and provider so they know what you're taking. If you're pregnant or breastfeeding, you definitely need to talk to your provider, and we need to determine the risks versus the benefits. Bupropion's a very interesting drug. It makes dopamine and norepinephrine available at the nerve synapse, other than SSRIs, which deal with serotonin. It can be used for smoking cessation. It can be used as a diet aid, and it works a little bit faster. It has also been used for ADHD. So this drug does have a place in our toolbox for depression. If you know anyone who would benefit from this video, please send it to them. If you've enjoyed it, give it a thumbs up, and please subscribe to my channel for more happy, healthy living information. If you have any questions at all about bupropion or any other drug, feel free to email me at michael@pharmacistmichael.com, and I will answer every question that comes my way. My name is Pharmacist Michael. Be happy and be healthy.